Okay, it's Dr. Buford here. Can you turn my outflow up to high? Turn my, yeah, hold this, please. It's Dr. Buford here. We're just getting started on the right shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen. We've got two working cannulas coming in the front of the shoulder. Your biceps tendon's here on the left. The slap lesion that we were talking about is this. See how that edge is frayed and it's loose all the way back to here? There's a couple little tips and tricks we use to make the diagnosis, and you're showing us most of them. Okay, see that there? See how that can come up just with a little bit of tension on it. It displaces. So we're going to go ahead and take that. We're going to take the shaver and we're going to go ahead and get to work on this. Your rotator cuff is fine. There's a little bit of undersurface fraying, which is not uncommon in this situation, but that's not the underlying problem here. You did not, hold the camera here, you did not have any instability on examination, so that was good too. So we're going to go ahead and start the shaver here. We're going to take some of the cartilage off so we can get this to heal, but this is also how we make the diagnosis. See how the shaver just slips right down there? That's also not typical of a normal insertion of the biceps tendon. So we'll go off on the video now. Nope. Push down the button. So you can see how we keep working here until that white cartilage is removed, and now we can see the bone underneath, so we can get the tissue to heal back to the bone. Hold the camera here, but not so much the cartilage. So we're going to keep working here, take off a little bit more cartilage so we can have more surface area to heal. We'll show you some more in a little bit. Pause. Okay, so here's our anchor. It's double loaded. We have it down in the bone here. We're going to reach in and take out 3 of the sutures first. So we'll get these 3. Hold the camera here. And after we get those 3 out, we'll take a switching stick and take these outside the cannula. Okay. So now those are out of the way, and we're ready to take the one suture we want to work with first inside the gray cannula. Okay, and now we're going to get to work on passing our first stitch. Pause. Doesn't matter. Okay, so we've got our needle underneath, and we're passing that black wire that's called a super shuttle or a relay. And we can just retrieve that anywhere really, but hold right here. Pause. Okay, so we've put 2 sutures on either side of the biceps, and that looks good as we stretch out the shoulder. Just some minimal fraying on the cuff, nothing there to worry about. As we look towards the back, there's a little bit of a flap tear also in the back of the shoulder. So if I can't get there from the front here, then we may have to switch positions. But if I can get there, see this little cartilage flap? So we'll take care of this, and then we'll get you back to recovery. Good luck to you now. Bye-bye.